One is machine learning, which enables machines to learn from data. I'm trying to simplify as far as possible. I'm not going to the semantics of it. Just a basic layman, what does it really mean? So machine learning is where it enables machines to learn from data. The algorithms would parse through data, learn from it, and then make informed decisions. Natural language processing, which focuses on the interaction between computers and humans, and then computer vision, which enables computers to interpret and understand the visual world. So there are going to be software applications which will become a little more accurate at predicting outcomes and without the programs being planned explicitly. So with an interplay of these three things, artificial intelligence, machine learning, deep learning, the historical inputs are going to become my new output. It's going to give me a better understanding of what I'm doing. But now the question arises, if it is that easy, if it is that feasible, is my computer going to learn? It can go onto the internet. And what if my computer then, or my artificial intelligence becomes self-aware? Are we looking at a scenario where we are going to deal with another Terminator? No. So these are science fiction. This is just in movies. So you have to understand artificial intelligence has a lot of layer to it. So the machines that we use are, so they can be reactive machines which have no memory. They're task specific, can make predictions, but really can't use past experiences. Second is limited memory, where they can use past experiences to make new ones, like self-driving cars that we have. And the theory of mind, where eventually the system begins to have intelligence, where it starts to predict behavior of the surgeon. That is what gives me motion scaling. That is what we are using today. And the last one, where it has a sense of awareness. The machines that understand, they have this sense of their own state. Well, such machines do not exist as of right now, so it's nothing to be worried about. How AI enhances robotics is Dr. Tushar also already covered this. When we talk about AI, what it has is convolutional neural networks, which does is it has ability to store learning patterns. So see, the AI understands there is a bird, and with a lot of convolutional neural networks, what it understands is it a bird versus a dog versus a cat? Then it goes into deep learning. When it goes into deep learning, a little more complexity starts to happen. It's when it starts off supervised and reinforced, and then finally unsupervised learning, where it starts to now differentiate between one kind of bird. And finally, hidden Markov models, which build probabilistic and predictive models for us, which has the potential to predict surgeons' intentions. We are already living in the future. So this all what I'm telling you is already happening. We just don't know it yet because we have not seen it yet. So this is micro technologies and systems for robot assisted laser phonomicrosurgery, which is already in vogue. So what's going to happen is there is a robot assisted endoscope that we insert with a stereo vision and a laser unit. What it does for me is it's going to give me a three-dimensional reconstruction of the vocal fold area of interest with a colored coded overlay of the focal length of the laser that I'm using. It's going to create a mesh-based deformation modeling of the vocal cord for me, and then tell me which is the appropriate place for me to place a perfect incision line. And not only that, it's not going to stop there. It's going to tell me if the laser that I fired, was it enough? Have I taken the adequate depth? It's going to tell me for me to create a creator. What are the steps that I need to take? What are the planes that I need to achieve? So that's where AI is going to change how robotics is happening. We've already seen it's no longer enough to know the anatomy. We are going to see a lot of robotics that are going to be integrated with the functional and the physiological aspects of the tissue at hand. So when we talk about transoral robotic surgery, the most common limiting factor is because there is a limited access, because there is we are working in a very out of the line, out of the site access. So there is a likelihood having positive margins. So once integrated with narrowband imaging, probably that will go away. And Da Vinci is the leader in the system in the market because they understand this. So the new Da Vinci system, the Da Vinci 5 that has come, it's already been built to enable the future of AI and machine learning into the system with over 10,000x the computational power that is present in the XI system that we have today. How it helps me? How does it help me? Because it helps me have an objective skill assessment with the goal of improving the patient care. The flex robotic system that's already again in pipelines, and it's made by the med robotic system with a control flexibility with a single port assisted flexible endoscopic system. So when you see the XI system that we have for Da Vinci, it's got bulky arms. It's got bulky arms that are limited by the amount of exposure that I can achieve with help of my tongue depressors. But the flex robotic system beats that because it's got a flexible deployment. And once we do that, the hard to reach areas, we can reach there and perform precise surgeries. Da Vinci is not going to be undone by other companies. So they also have come up with the SP system with a similar approach. There's going to be a single port system with flexible endoscope. It's not yet received a CE or a FDA approval for transoral surgeries, but it's already being started for abdominal surgeries. The future essentially is going to roll about is going to be rolling about this particular slide. So no matter what we do, all the systems that are going to come up in the future, everything is going to revolve around this particular slide, which tells us we are going to shift from a master-slave configuration to a master-master configuration. It's going to be a hybrid approach between a minimally invasive surgery and a remote access surgery. So there's going to be combination of multiple equipment, multiple instruments that are going to give me the best possible results. Then a vision card system that is not limited to human visual spectrum. There are going to be additions of functional and physiological aspects to it. Tools that are more human hand-like. In fact, the Da Vinci 5 that's coming up, the one of the nagging factors with Da Vinci system was there was no haptic feedback. Now it says it's going to give you a certain amount of haptic feedback, which is going to help you reduce the pressure that you apply by around 40%. And then we're going to get a little more intelligent tools with better accessibilities. And finally, we're going to integrate virtual reality into it. So as you saw, sir, he was doing neuro navigation in the last slide. This is what is the future is going to be. So there is a internal carotid artery after doing a sphenoidotomy that has been superimposed on the live endoscopic video stream, which tells me in the planar view how far is my carotid artery from my point of contact. So that is how augmented endoscopy is going to help me when translated into robotics. How it helps me is it gives me an anti-collision guidance, creates for me a virtual guiding tunnel, and eventually what the world is going to go to is we are going to give it short autonomous tasks. And as sir was saying, probably we will see a time when it might be able to do whole program executions on its own. How do we do it really is that we first create, number one, my target site, and then we create a trajectory and superimpose it onto the images that we have. And then we can see that either by by autonomous trajectory, that is the yellow dotted curve, or by the guided co-manipulated surgery that the surgeon himself does. And we can see how we reach the target area. And this is again a model that was built for a real patient. The mean measured precision is 0.1 mm for the autonomous trajectory and is 0.83 mm for the when the surgeon does it himself. And as you can see, this is the robot movement dynamics. When I have to reach a target, this is how I reach. When a robot has to reach a target, this is how the robot reaches. Hence the accuracy, hence the precision. So this is what is already in vogue. This is what is present already in my robotic system, where there is a master control. I make a movement, it goes to a trajectory planner, it goes to a kinematic solver, which makes sure the instruments don't collide, which is get translated into the position encoders, which tell my arms where they are in respect to this patient, and my motion that gets translated to these encoders in terms of precise numerical values. So since we are in a 4G platform, so I thought this is, I'll try to explain the same thing in a 4G manner. So if you see the first one, it's all scattered all over. So it's neither got the accuracy and repeatability is very poor. The second one, the accuracy is very good, but the repeatability is bad. In this one, the repeatability is good, but the accuracy is gone. What the robot is going to do for me is it's going to have a good repeatability and the accuracy, which I cannot get as a surgeon. So now is the same slide, which I had shown you 2 slides back, except what has happened in this slide is the same task order that I was giving earlier is going to be given, but they are now going to get translated into the AI, which as I showed you has probabilistic models. Now these probabilistic models are being generated by Markov modeling. So which estimates what kind of task I am trying to do. This sends the data to my trajectory planner, which tries to make sense of the intention that I have, the precise movement that I'm to make, and then gives me a correction for that. And with this, again, I'm able to target the tissue slightly better. If you remember, when I started off my presentation, I had given this Sanskrit shloka. Essentially, accuracy is the essence of knowledge, the essence of wisdom, the essence of stability, and a sense of intelligence. Robotics give me that. And artificial intelligence is going to further enhance it. A lot of papers have already started to come in. These are all papers in last 2-3 months, and people are already working on it. This is all related to artificial intelligence and otolaryngology. While I am about to finish my slides, I would like to thank my teacher, Professor Naresh Panda, who taught me all this, and former assistant who watched in bewilderment how he performed these surgeries, to somebody who could eventually perform these surgeries. Today is a special day because tomorrow sir retires, and I wanted to thank sir for teaching me, and thank you for listening to me from the bottom of my heart. Thank you, sir.
Colonel Vikas, that was an excellent presentation.
Yes, sir.
The oration as well as the content was very good. Because of the paucity of time, we'll reserve questions during the lunch time, if you don't mind.